Welcome to Talking Type 1 Diabetes, a podcast series for healthcare providers who manage or treat type 1 diabetes, or those who just want to learn more about this life-changing progressive disease. Each episode features conversations between leading experts in the fields of endocrinology, primary care, and diabetes care. This episode reviews how our experts discuss TZIELD treatment with their patients and address patient questions and concerns. You will hear from Dr. Thomas Blevins, a distinguished endocrinologist and the founder of Texas Diabetes and Endocrinology in Austin, Texas, and a fellow of the American Association of Clinical Endocrinology, and Ashlea Hill, a respected endocrine nurse practitioner and certified diabetes educator. She is the owner and clinical director of the Diabetes Care Center of Louisiana in Ruston, Louisiana. Our experts will discuss patient questions and concerns as they pertain to their experience in practice. Dr. Blevins and Ashlea Hill are being compensated by Sanofi for this podcast episode. TZIELD is a CD3-directed antibody indicated to delay the onset of stage 3 type 1 diabetes, T1D, in adults and pediatric patients aged 8 years and older with stage 2 T1D. Please see important safety information on screen and additional important safety information and full prescribing information provided at the end of this episode. To kick things off, let's discuss how our experts introduce TZIELD to their patients and the initial steps in preparing them for this treatment.
So how do you introduce and kind of tell people about treatment? And some of the key points I know that we emphasize is that I want to have a number of visits with the patient. That's really important. And I try to make it very available. In other words, we may take a few visits to talk to them. I try to keep things moving because I always feel this kind of sense of urgency to get the person educated. And people like to go back and talk to their partners, their family. I tell them to bring them into the visit and ask questions because commonly it's kind of almost like a family group, decision. And one of the first things, of course, is to make sure that they are actually candidates for TZIELD and they have stage 2 diabetes. That is, they have at least 2 positive pancreatic islet antibodies and dysglycemia without a diagnosis already of diabetes. And then the next thing that we talk about, of course, is some of the data and what they're actually getting into. And we'll talk about more about side effects in a minute, but we talk about the study that showed that diabetes can be delayed. And we would talk about the approximately 4 years onset after treatment instead of 2 years without treatment. One thing we also talk about is we talk about who shouldn't get it. And, it's always important to say who should get it and who shouldn't get it. And people with certain lymphocyte counts, blood count that's low, platelet count that's low, things like that, elevated liver test at baseline and things like that, they shouldn't get it. So we go through that. And if people have evidence of acute infection with Epstein-Barr or cytomegalovirus, they need to kind of delay. And certainly if people have infections and things like that, we don't give it. And I talk to people about that too. Usually people have been screened through by that time. We know they don't have those things.
Right. And we've seen a few that may have had that initially because they had some underlying mono or something going on that they didn't know. And then we waited it out. We retested for those things and then we were able to infuse.
Yeah. And one of the people, it was kind of like we were preparing last year to infuse someone, and it was coming up to the flu season, and so it was kind of important, and it's always important to talk about vaccinations, and so the bottom line is with TZIELD, safety of immunization with live vaccines has not been studied, and so the recommendation is we went through this with this patient and administer live vaccines 8 weeks prior to treatment, and not recommended during treatment or up to 52 weeks after. Of course, most vaccines aren't live, and killed vaccines at least 2 weeks prior to treatment, and not recommended during treatment or for 6 weeks after. So that was a big deal because we were coming up to flu season. We got her vaccinated early, and then kind of followed those guidelines.
Thank you for the comprehensive overview of the initial patient preparation. Now, let's dive into the mechanism of action of TZIELD and what patients can expect regarding potential side effects during the infusion process.
So with the mechanism of action, so how do you tell that to your patients? How do you try to simplify this?
Yeah, the mechanism of action, I tell them, it blocks the activator of the T cell. And we do a little immunology lesson, and that is when we talk about T cells and how they attack the pancreatic cells and inactivate the pancreatic cells over time. And we talk about how CD3 is kind of the activator. And do you use any kind of examples or analogies to describe how
we
T
talk
cell
about
works?
Really, we keep it pretty simple. We love all the brochures. We give them that. They reach out to some patients that we've infused. If they like to, we give them those numbers. But, we just talk about it can put the brakes on. And we really try to keep it pretty simple for the most part in the beginning, and then let them kind of do their homework with all the great handouts and brochures that they have. And then we follow back up.
Yeah, I'm with you. Educating the patient is the most important thing. And we use some metaphors too, like blockers, or we talk about engine, that the CD3 is the engine that fires up the T cell to attack the pancreatic cell. And I say, this TZIELD stuff sort of inactivates the engine, so it doesn't power up the T cell, and the T cell sort of exhausts. And, there are all kinds of ways to talk about it. But
they seem to get those analogies like that, and they will remember that. So I like that.
Yeah, I think so too. And how do you talk to people about the side effects of TZIELD? Things that they might anticipate.
And we do go ahead and pre-med each day, but anything we find that they can do is really just therapeutic for them, for just those OTCs to take. And we go ahead and prepare them. Like on day 5, we expect these counts to work, just to know that it's working. So right now we're trying to get this done before they go back to school and things, just worried about, their susceptibility to others that they're around. But, they get that, and they're absolutely willing to do that.
Yeah. And I think you're right. Educating them about side effects so they know what to expect is a big part of the process. And I usually just, go through headache could happen, lymphopenia, just, the blood count thing. I tell them that a high percentage of people are going to have that, and we're going to watch for it. And rash, like I think in the study was 36%. I just tell people you're going to get a rash. And it's not an allergy. Antiemetics, antihistamines, all of that.
So do y'all continuate for the full 14 days?
We premedicate, and then we tend to, we do. And we also have additional meds available. And as you're talking about, it's really important, I think, to tell people that ahead of time. We're in their corner. We're going to help them get through this. And they're likely going to have some symptoms. And we go over those symptoms, as we talked about a while ago, very carefully. And we tell them we're going to pre-medicate you. We're going to have medicine available for you anytime you need it. Exactly. Well, it sounds like we do the same thing. We talk about something I know they're going to read about, and that's Cytokine Release Syndrome, CRS. And that's when, people get rash, fever. They could get, headache, could get the whole 9 yards. And we talk to them about that. That does happen. We don't want to ever minimize the risk of that. Fortunately, low percentage of people, and typically people do get over that.
Thank you for sharing insights and experiences on treating appropriate patients with TZIELD to delay the onset of stage 3 T1D. Now, let's discuss the importance of continued monitoring after TZIELD infusion and how our experts address common patient questions and concerns.
How do you explain to people the importance of continuing monitoring, like during treatment? Monitoring for, I guess, really elevation of blood sugar and progression or lack of progression during and after treatment. What do you tell
and this
people?
has gotten a lot easier to get CGMs for people also. So we go back through, if you're sick, if you've had some events, maybe they're going to slap their CGM back on. We still like to follow them just because we wanted to see the data, and usually they did too. We're drawing their C-peptide. We're still seeing them. A lot of times still quarterly. Some we've pushed out to every 6 months, but I wanted to see the data still for our patients on our end, and they did too. So it really wasn't a hassle for them to follow back up.
Yeah, we were similar in that way. We've had one person who I think she was very just exhausted from all the attention and all that, and then she kind of was reluctant to continue on, but she came back on in, and we monitoring after treatment. We tell people we have to keep monitoring you to see what happens, because we're going to delay, not prevent. It's not like it's over with, and and they're now very educated, just as you point out, and they can do things. And I think the current kind of guidelines would say monitor the pediatric patients, as you said, quarterly. And everybody could be monitored quarterly, really. And then in the adults, maybe a little bit less often, after a few times every 6 months at least. And we tell people that and kind of stick with that monitoring. As you said, like CGM, A1C, if they want to do finger stick testing, all of those things are important. Some people do oral glucose tolerance tests routinely. Do y'all do that?
Yeah, I'm not going to torture them through that, right?
No.
No. What about some of the antibodies? Like if they've wanted to see them all again, have you seen these antibodies wax and wane through this?
Yeah, we've done those off and on, and I haven't done it routinely in everyone to find out. And I think that's a great question. And what are you doing antibodies?
When you've seen that and you can see that this was positive, now it's not, these numbers are shifted, then it's such a long conversation after that. So we're not really drawing all the antibodies again, because we know this is meant to delay, and kind of getting into that can be a real confusing thing. So in the beginning we were, but I'm not really doing that as much routinely now.
In fact, that gets into a really interesting component of the discussion, and that is, what are the most common questions and concerns that you get when people are going to get TZIELD, and what do you tell them? I mean, what are the most common questions that you get? This, I think, would be helpful for our audience to hear what kind of questions we're getting.
Right. As far as questions, gosh, there's so many, and with who to screen, a lot of times are questions that we will get from maybe healthcare providers or things. And I can tell you that 5 out of the 22 we did came in for working up a hypoglycemia. And then they were found to be perfect stage 2, not really, even with having too high of blood sugars yet. Some of those we kind of had to sit and wait to get them ready, but the antibodies were there and they came in from really feeling low. So that was kind of interesting to me. Yeah,
I think so too. And that's interesting because we've had the same. I had a woman who has type 1, and she said her son, who hadn't been screened yet, was having hypoglycemia. So of course I said, get him screened right away. Of course I was going to say that anyway.
Right.
And like you. I think there's another session that talks about screening, but we all have our own experiences and right. screen. And it turned out when he screened, he didn't have antibodies. It surprised me because I thought that's for sure going to be a person that has stage something, type 1 diabetes. And, the interesting thing is we've found a number of people who have one antibody, and what do you do there, and what do you tell them? And, stage 2 is greater than or equal to 2, and dysglycemia, and one antibody doesn't really fit in the staging that well, but we do monitor them very closely and check their antibodies again.
Monitor. That's right.
Monitor.
That's right. And, screen. Monitor. That's what we do. So.
Yeah. And we get questions, as you do, about effectiveness of treatment. We've kind of already talked about that a bit. Side effects we've talked about. We get questions about the treatment itself, the infusion, and how it's done. In our site, in our location, we use an infusion center, and the people are willing to come in on weekends. There are different ways to do it. And how do you do it at your site?
So we infuse at our office. So we have an infusion center there, and we provide the infusions on the weekend. We've never, there's so many. We can white baggage. You can use home health. We've just always done it inside our office for the full 14 days. We actually have a pharmacist right now that kind of knew about it, screened himself. So he may be the first one that we let go home and do it after day 5. So.
Got it. Got it. Interesting. I think every site's going to have its own way of doing things, and
Yeah.
we get questions too about cost and coverage, and I know you do too. And we've been successful so far. It sometimes takes some time, and I've gotten on the phone myself, many more than once about talking to the medical director or somebody with the insurance, and I suspect we have similar experience in that area. Another question that comes up often is what about psychosocial care, and because a person now finds out that they have this stage 2 diabetes, they're at risk, and you can tell them that with stage 2, their progression is going to be 70 to diabetes overt, 75% at 5 years, 100% over a lifetime. It's going to happen. And so that can create a lot of anxiety and concern, fear, and then you talk about this treatment, and there's more to it.
Right. It may take 2 weeks of your life, but it's
right.
They'll find the time to do it for 30 minutes a day for the 2 weeks is what we found. So.
The question is, I guess in some healthcare systems, it might be a psychologist or someone to talk to people.
Yeah.
What do you do at your site?
We don't. We offer, patients who've had that. Our infusion nurse, like we said, she and her daughter, and there's so many other avenues we don't have. I mean, we're not trained psych people at all, but, we found just the comfort conversation, just like you and I are having them with different personal experiences. Yeah. And, then they get on the internet and they can find all kinds of people and sites. And for our patients, that's been enough. They haven't, wanted to go anywhere else.
Yeah.
But we always tell them that is an option.
We're very similar in that regard. We think that education, as you do, and having them talk to people who are knowledgeable and talking to us multiple times. I tell people, come in as many times as you want. We'll talk as much as you want, either in person or telemed. Bring your family. Go home and talk to your family about this if that's relevant. I mean, it may not be. But and so, like you, we kind of use what I would call an education model for counseling. The more people know, the better off. The truth will set you free, and that kind of thing. And if we haven't had a person yet who's really required, intensive counseling, but if that could happen, and I can see that, and we do have people we could refer them to.
Right. Same here.
Yeah. Well, Ashley, any further comments about the patient concerns, frequently asked questions, or?
I think you've covered it.
Yeah, I think so too. Well, listen, thank you very much for your participation. I really enjoyed talking with you today.
Yeah, same with you.
Thank you to Dr. Blevins and Ashlea Hill for your valuable insights on preparing patients for TZIELD infusion. Your practical advice on communication, managing expectations, and addressing concerns will certainly assist healthcare providers in supporting their patients through this treatment. Thank you for listening to Talking Type 1 Diabetes, a podcast series for healthcare providers who manage or treat type 1 diabetes. Be on the lookout for other episodes of the Talking T1D podcast, available on TZIELD-HCP.com and YouTube. For more information regarding TZIELD, visit our website at TZIELD-HCP.com. Please be aware of the TZIELD indication and important safety information, indication and usage. TZIELD is a CD3-directed antibody indicated to delay the onset of stage 3 type 1 diabetes in adults and pediatric patients aged 8 years and older with stage 2 type 1 diabetes. Warnings and precautions. Cytokine Release Syndrome, or CRS. CRS occurred in TZIELD-treated patients during the treatment period and through 28 days after the last drug administration. Prior to TZIELD treatment, premedicate with antipyretics, antihistamines, and/or antiemetics, and treat similarly if symptoms occur during treatment. If severe CRS develops, consider pausing dosing for 1 to 2 days and administering the remaining doses to complete the full 14-day course on consecutive days, or discontinue treatment. Monitor liver enzymes during treatment. Discontinue TZIELD treatment in patients who develop elevated alanine aminotransferase or aspartate aminotransferase more than 5 times the upper limit of normal, or ULN, or bilirubin more than 3 times ULN. Serious infections. Use of TZIELD is not recommended in patients with active serious infection or chronic infection other than localized skin infections. Monitor patients for signs and symptoms of infection during and after TZIELD administration. If serious infection develops, treat appropriately and discontinue TZIELD. Lymphopenia. Lymphopenia occurred in most TZIELD-treated patients. For most patients, lymphocyte levels began to recover after the 5th day of treatment and returned to pre-treatment values within 2 weeks after treatment completion and without dose interruption. Monitor white blood cell counts during the treatment period. If prolonged severe lymphopenia develops, less than 500 cells per microliter lasting 1 week or longer, discontinue TZIELD. Hypersensitivity reactions. Acute hypersensitivity reactions including serum sickness, angioedema, urticaria, rash, vomiting, and bronchospasm occurred in TZIELD-treated patients. If severe hypersensitivity reactions occur, discontinue TZIELD and treat promptly. Vaccinations. The safety of immunization with live attenuated, live vaccines with TZIELD-treated patients has not been studied. TZIELD may interfere with immune response to vaccination and decrease vaccine efficacy. Administer all age-appropriate vaccinations prior to starting TZIELD. Administer live vaccines at least 8 weeks prior to treatment. Live vaccines are not recommended during treatment or up to 52 weeks after treatment. Administer inactivated, killed vaccines or mRNA vaccines at least 2 weeks prior to treatment. Inactivated vaccines are not recommended during treatment or 6 weeks after completion of treatment. Adverse reactions. Most common adverse reactions, more than 10%, were lymphopenia, rash, leukopenia, and headache. Use in specific populations. Pregnancy may cause fetal harm. Lactation. A lactating woman may consider pumping and discarding breast milk during and for 20 days after TZIELD administration.